Hey guys, what's up? Today I'll be discussing about the visual field defects. My name is Dr. Susan Kafle, so without a delay, let's begin. The visual fields that we see, it can be divided into the lateral side and the medial side. The light from the lateral visual field falls in the medial retina, whereas from the medial field, it falls in the lateral part of the retina. So same thing is happening in both the eyes. The light is crossing before it strikes the retina. So after striking the retina, the optic nerves of the either sides would carry the visual input. The light from the lateral retina would travel towards the same side into the geniculate body, and then from there it goes via the optic radiations to the visual cortex. This part is the optic nerve. After optic chiasma, the tract is called the optic tract, and then after lateral geniculate body, it's called optic radiations. As you can see over here, from the medial retina, the optic nerve carries the visual sensation up to the optic chiasm, and in optic chiasm, it crosses to the other side to join the fibers of carrying the visual input from the lateral half of the other side. So we have the crossing in the optic chiasm. Now, if we try to look at this from the lateral side, the visual field is this red oval. The light from the superior visual field would project to the inferior retina, whereas from the inferior visual field would project to the superior retina. The visual input would then be carried to the lateral geniculate body, and from the lateral geniculate body we have two types of optic radiations. One is the superior optic radiation, or which is called the parietal optic radiation, and the other is the temporal optic radiation, also called the Meyer's loop. So these would carry visual input to the visual cortex, and then would see the image. At times you only have the involvement of the parietal optic radiations. If the parietal optic radiation is involved, then if you trace it, you trace it to here and then here. So the inferior portion of the visual field will be lost, whereas the superior portion of the visual field is lost if the temporal optic radiation is damaged. Now let's discuss the different sites of lesion in the visual pathway. First, the optic nerve. If there is a lesion in the optic nerve, you'd have complete blindness in one of the eyes, because optic nerve is carrying the fibers from the medial as well as the lateral retina. So one number is the optic nerve involvement. Since the right eye is involved, you'd have complete blindness in the right eye. What happens if there is a lesion in the optic chiasm? I'd highlight this with black. If there is a lesion in optic chiasm, you have the fibers that are crossing. So these fibers are crossing in the optic chiasm. In tumors like pituitary tumors, you'd lose these fibers, and then if we trace it back to the visual field, we can see that you'd be losing the lateral side of your both visual fields. So the lateral side of the visual field is also called the temporal side, and we give the names to the hemianopias based on the side of the visual field that is lost. So you'd have the visual field defect that looks like this. It is called bitemporal hemianopia. Now the third place where the lesion can occur is in the optic tract. Say that we have a right optic tract lesion, which I've denoted with this yellow ink. All right, so if we lose the right optic tract, if we trace the fibers, we can see that we are losing the medial side or the left side of the right eye and left side of the left eye as well, I mean the visual field. So this would produce a visual field defect like this. You're having a lesion in the right side, right optic tract, but the visual field defect is occurring on the left side of the visual field. So there would be contralateral homonymous hemianopia. What will happen if there is a lesion in the optic radiation? So optic radiation is here. So if you have a lesion in the left optic radiation, you trace these fibers all the way up, and then you see that you're losing the right side of the visual field on both the eyes. So having a lesion in the left optic radiations would cause you to lose the vision on the right side of the visual field. So again, we have contralateral hemianopia, but in case of optic radiations, you also have to remember this picture. Because the projections from the lateral geniculate body to the visual cortex via the optic radiation is through different fibers. You have the parietal optic radiation fibers and then the temporal optic radiation fibers. So you may have the involvement of one of these two fibers. If the parietal optic radiation fibers are involved, you'd be losing the inferior portion of the visual field. If the temporal is involved, then you'd be losing the superior portion of the visual field. So rather than just saying hemianopia, we should say we'd have quadrantanopia. Say that we have the involvement of the parietal optic radiation on the left side, then we'd have the loss of visual field on the right side in this manner in both the eyes, and the visual field defect would be occurring only in the inferior portion. So we call that contralateral homonymous. Homonymous means the same side, quadrantanopia. Now similarly, if we have the temporal optic radiation involvement, we'd be losing the superior side of the visual field on the contralateral eyes. So we call that contralateral, again contralateral homonymous quadrantanopia. Parietal optic radiation would cause inferior quadrantanopia, whereas the temporal optic radiation would cause superior quadrantanopia. Now last but not the least, the primary visual cortex. Again, involvement of the primary visual cortex, if we trace it all the way up, we'd see that there would be contralateral homonymous hemianopia. But as I said in my video on PCA stroke, the macula of retina is also supplied by the middle cerebral artery, so we'd have macular sparing. So if we have the involvement of right visual cortex, then we'd be losing the visual field on the left side, so we'd have contralateral or left-sided homonymous hemianopia with macular sparing. Now let's do one question on this. A 58-year-old man comes to the clinic after noticing that the upper left portion of his vision in both the eyes has been missing for the past week. He reports that he often bumps into the objects when walking, particularly on the left side. Medical history is significant for poorly controlled type 2 diabetes mellitus and smoking. He denies headache, weakness, and numbness. Which structure is involved in this patient? So this can be done by drawing the visual fields, but after the optic chiasm, we have the involvement of the same side in both the eyes if the lesion is after the optic chiasm. All right, so this patient has upper left portion of his vision loss in both the eyes, which means the lesion is after the optic chiasm. So he has a visual field loss like this, and if we go by the rules, visual field loss on the left side means there is a structure involved in the right side after the optic chiasm. It can be optic tract or optic radiation or the visual cortex, but as we discussed in our previous slide, when there is involvement of the superior portion, the lesion would be in the temporal optic radiations. So we have the involvement of right temporal optic radiation in this patient. You can draw the visual field to solve this questions like these, but if you know this hack, then it will save a lot of time in the exam. So thank you for watching this video. Have a great day. Bye.